Hey everyone, we are really excited to be sharing this Facebook Live with you today. We have a special guest with us today. Jamie Flanagan from CareStack is one of our new partners here at Dentist Advisors, a cloud-based platform for utilizing inside your office for all things management and tracking and running your systems. We have really enjoyed getting to know CareStack, and Jamie is our main point of contact for all of our clients. And today we get to have Jamie just talk about CareStack, about their product, and for all of us to really get to know it. And at the wrap up, you'll be able to have all of her contact information and be able to reach out and continue the conversation. So Jamie, so excited to have you.
Thank you. I'm so excited to be here.
Thanks for preparing a deck for us, and I'll let you take it from
Yeah.
here.
Yeah. So, just a little bit of background, just so that you guys can have some relatability. I have used our system, multiple locations, different offices, different specialties, both clinically and administratively. So, I come to you having been a user, having been through these kind of decision making processes and having to kind of undertake this. So, I really want to show you how CareStack is really able to help improve your efficiency, schedule those treatments faster, collect those funds, get better reporting, really just try and centralize everything to be able to better manage your practice. So here I am going to start by just showing you that we have daily kind of dashboards, we've got lists, patient engagement, all of the kind of electronic health record information that you need as a dental practice as well. But having everything centralized into one system really just gives you so much more versatility to work more effectively as a team and to not have to go to these secondary softwares to help manage everything. So let's start with daily dashboard here. This is kind of as you first log into our environment. I just wanted you guys to be able to see. This is not necessarily your scheduler, but it's going to be information that you can see at your fingertips. So you can see everybody that's in the schedule today, what their status is, who they're seeing. Also, too, in our additional info, we really want you to have information at your fingertips. So anything in CareStack that's blue, green, or red is going to be hyperlinked. So you're going to be able to, from this screen, you're going to be able to see their balances. You're going to be able to see if they've got forms. You're going to be able to call them directly, see their insurance information. All of this in one centralized place. As you can see on the left side, you also have KPIs. Some offices also want to kind of dictate who can see those KPIs, so we can also do different permission settings, etc. But this is a good way to start the day, kind of get your checks and balances done, make sure everything looks right, and make sure that you're on track. Now, as you look at the top of this screenshot, you're going to see performance planner, huddle, work lists, production goals. This is again stuff that we think is going to help you centralize all of your information. If this is something that even looks remotely appealing to you, we can always do a demo and I can really dive into each of these tabs. But let's look at the huddle dashboard. This is going to be kind of the day in a snapshot compared to the following day and the previous day. So this is a report that a lot of people will start with that huddle process with. But it all updates in real time as well. And this is stuff because our system is cloud based, you are going to be able to access this from anywhere. We have very high levels of security as well. So I know that's a common question, but this is something that, say, you aren't in the office, but you want to just check in on how the day looks. This is how you're easily going to be able to do that. No more VPNs, no more having to look at 5 different softwares to see who's confirmed, what the production is, what's been paid. All of this is going to be centralized. One of our big things with that being said, reporting. We have so many different just like preset reports, but our operational reports, just like the hyperlinks in your daily huddle start, all of our reports are going to be able to get you that detailed information as well. One of our most common reports that people love is the income allocation because it really kind of breaks things down granular level as well as overview. So you're going to be able to see your production, your collection, your adjustments, everything all in location view and provider view. But say you want to see, okay, we've got a $987 production adjustment. Okay, what is that? You're going to be able to click into that and see directly who that adjustment was applied to as far as a patient basis, but also too, you're going to be able to see who did that because everything is updated and user based and user login based, I should say. You're going to be able to see, okay, why was this adjustment done by Sally? Okay, is this something that's accurate? Do we need to do some more training? What's going on here? So it's very comprehensive to be able to get all of these reports in one place from multiple different areas of the system.
And Jamie,
Spencer, do
so
you?
good, yeah, so
Yeah.
good to have it at your fingertips for the morning huddle that you mentioned
Yeah.
earlier. Just some are looking for content to present in the huddle, and it's like,
Mhm.
here is some extremely useful data to share.
Absolutely. And these are also because we have goals in the system. You can see here the red numbers. You're down for the day. That's
Mhm.
below your goal. What can we do on a daily basis to get that back up to where it needs to be? Sometimes numbers can be scary for people, but to really maximize what your
Mm.
practice is doing and really be able to grow and give at the end of the day that best patient care, we want to automate this and help you understand what these numbers are. And that's where Dentist Advisors comes in, and that's where CareStack comes in. We get you the information and we help you grow, both of us together. Does that help make sense?
It does. And as Jamie's mentioning, we love all the data that we can see with you as we review with you your year end or quarter over quarter. The data is so helpful.
Exactly. And I don't have a screenshot of this, but I will mention, like Spencer was just saying, year over year, month over month, whatever the case may be, excuse me, we do have trend analysis as well directly built into the system. So again, it's going to be doing this work for you in the background and being able to produce these results for you and these numbers so that you can get to that next level and don't have to do it all yourself and
Mhm.
search high and low for this data.
Yeah.
Analytics dashboard along the list of all the reporting. This is kind of a good view. You can see on the top, there's operational reports, scorecards, analytics, the trend analysis, XYZ on the top. These are all aspects of our reporting capabilities. Now, analytics dashboard. This is something that is very useful to be able to kind of continuously monitor. So what I mean by this is you can have as many dashboards as you want, but all of these are going to be updating in real time. So if you log in this morning and you got 170,000 of insurance aging, let's hope you don't have that, but in case you do, you're in the right place where we're going to be able to help get that. And say you get a big check for a $20,000 bulk check by the end of the day, as that is processing and being applied, this is going to update in real time. So you can
Mm.
see that information. You can see, say you wanted a daily analytics dashboard of how many people were scheduled, your scheduled production versus actual production, who canceled. All of that is going to be customizable, again, with permissions to be able to see this information updated in real time.
This is another great huddle dashboard to be presenting to the team in the office.
Exactly. And I've even seen some offices where they will have this, say, shared on like a back
Mm.
monitor
There you
throughout the
go.
day so that people can kind of check in, be like, hey, we actually had two people cancel. What's going on? But then that
Mhm.
way they're not having to search it and everybody can have that information to better work together to get these patients into the schedule and not have those cancellations,
Mhm. Agree.
essentially.
It's good.
It's just one workflow, but scorecards are another option that I just wanted to include because we're able to look at data for providers. You can even look at it by codes, you can look at it by locations. And again, if any of this is enticing, please reach out. We can schedule a time to really dive into this because there's so much that you can customize in the data you can pull. But having been a hygienist for many years, I know that I had to look at different codes and say, okay, what was accepted? How many of 1110s did I do? How many did I do of a 4910? What are some of these data points for a specific time period so that I can make sure that what's being checked out and what having completed in the chair is accurate. Again, there's so many options. I just wish, and hopefully you guys can tell that I am passionate about this, but there's just so much and it's just automated. You can save all of these as favorites. So this drastically improved my time in having to pull my numbers to submit for production bonus XYZ. And it was just there. I could just change the date and all of my criteria was there. I was able to just boom, done. There it is. It's the same for, you can do it for each provider. You can have it be all of the providers in the office. There's just so much option to see everything totaled and consolidated.
Mm, it's great.
Now, when I was talking about everything being into one system, that also includes your patient engagement. That can be everything from your appointment reminders, that can be your happy birthday messages. It's all of the touch points that need to happen to keep these patients engaged. You can have one-time promotional campaigns as well. You've got extra whitening material. Okay, let's get that out and let's get that off of the shelves and get that money coming in. Get these people the bright white smiles for the holidays, whatever the case may be. But the other great thing, again, going back to the patient care, is we can even get granular with this as well and say 2 hours after a crown prep is done, we send out a text with automated post-op instructions, a link to the website for post-op instructions, checking in saying, hey, is your anesthesia wearing off? Please be careful. You could bite your cheek and like, let's not do that
Mm,
today. But just different customized things that can really make a difference. And I think all of us have been in the chair of saying, okay, we want to do this, but we're also being pulled in five different directions. And I've got a patient in my chair. I can't necessarily just take 5 minutes and call and get this one-on-one conversation going all the time. This is going to help stimulate that and automate some of this while still having that personal touch. And everything with our patient engagement is also a two-way texting situation. It can be an automated phone call that goes out, it can be an email, it can be text, but you're going to be able to see this and kind of have that running log of, okay, let's get in touch with these people. And it can even go if they do confirm and you want a 2 hour reminder, even if it's a confirmed appointment. Okay, let's do that again, saying, hey, we can't wait to see you. So
mm.
that's another thing, not going to another software. And I just loved that I could interact directly with these patients and make sure that they knew that we were here and get them those resources.
Very cool.
I think I had heard a statistic that it takes like at least 18 touch points in a year to keep a patient.
Yeah.
And to me, that was very surprising. I didn't expect it to be that high.
Mm.
It makes sense, but this is going to take a lot off of your plate. And we also, too, I want to mention, have a team behind you supporting you, that if you are like, hey, I need a campaign made, but I don't remember how to do it, we're there to help you with it. We have a very robust support team because I know, again, going back to having all of these hats and being pulled in many directions, sometimes you need help. We are very active in making sure that our clients are helped and have all of their questions and support answered.
Yeah. Hmm. That's great.
Claims. So I still do billing for for one of my practices, I should say. And claims module, all electronic dental records have essentially some type of claims, but ours is incorporated into the system. And there's a couple little things that just made such a difference. So we have a direct dental exchange integration, 100%. So any information dental exchange has, you will have access to. So with that, our claim forms are kind of editable, customizable. We can help automate templates, but you're going to be able to have kind of a support system thinking behind you before these claims go out. And so I don't know if you can see on the right, it says saved with, and then of course I can't show you the whole thing, but it says save with errors. We're going to help you think on the background, like if something's looking wrong or there's information missing, we're going to alert you to that so that you don't send off that claim and have to wait 2, 3, 4+ weeks to get a rejection. This is going to help you scrub that on the front end to make sure that they get that accurate information so that they can pay on that claim as fast as possible.
Mm-hmm.
You're going to be able to dictate what attachments are needed directly from here. And then, two, like I said, information they have, you have. If they deny it, if they give you a rejection code, if they need additional information, that is going to update and all be logged in our claims module. If you go into that pending payment tab and you open up a specific claim, you're going to see updates. If it's finalized, you're going to see that. And your team is also going to be able to make notes and again, log all of that. So we're going to be able to help you manage your direct aging field here with insurance claims directly here. You can pull another report. We do have that ability as well, but in our pending payment, you're going to see an aging column. That's going to help you focus on, okay, these are 90 plus days. Let's focus on these claims because the other ones aren't quite as pressing, but what's going on with these? We got to get these funds collected. Let's focus here.
Mm-hmm.
And so now, having used this system and seen kind of that level of organization, that claims management, it would be very hard for me personally to not use CareStack, but it's unlimited claims throughout our system, and it's just a wonderful integration. We will have Change Healthcare again, is what I'm hearing, but that will happen when it happens, when that infrastructure is rebuilt. So,
Okay.
do you have questions about that, Spencer, at
No,
all?
no, that is helpful to have here, and thanks for reviewing that.
Absolutely.
Yeah.
Yeah, it's a really slick system. And then when we kind of get down to the bottom line, as far as we're providing quality care for our patients, here's where treatment planning, of course, is needed. If you don't treatment plan it and you don't present this to the patients, they're not going to come in for it. So, our treatment plan, we help you build out explosion codes. We help automate a lot of this. Our treatment plans can also be sent to patient portal to be approved of. Mom needs to sign off on it, whatever the case may be. We're going to pull that insurance information, if applicable for that patient,
Mhm.
into that treatment plan, kind of analyze the deductibles, the frequency limitations, give you alerts if things aren't going to be covered, and be able to more accurately estimate what that patient portion is so that we can schedule and then we can collect on that date of service. We
Mhm.
can also assign time to all of our phases, which I know that I think there are some that do that, but having that communication between back office and front office, that can be so critical. I can't tell you how many times I sat next to a doctor helping out with a treatment plan and they're like, hey, this might be kind of a hard extraction or this decay is really rampant. I need a little extra time. That way, we're going to be able to customize. We're going to be able to have the front desk see it so that they don't get put in a hard spot and not know what they're scheduling for. The doctor has adequate time to give that patient what they need, but you're still going to be able to maximize your schedule.
Yeah.
So, the treatment planning is wonderful.
Yeah, agreed. So
Sounded
important.
like you had a question though.
No, I like this. I like this pay. I like this insight here. The planning is critical, and without it, it just doesn't exist. You're just flying blind.
Exactly. And for instance, I think this is a good kind of statistic. I could do a full mouth reconstruction, all implant fixed dentures, an entire treatment plan, every code in about 30 seconds to a minute max because of some of the automation that I had established. So
Mm.
no longer are you going to have your CDT book in front of you 24/7. You're not going to have the assistants that have the calculator tucked in their pocket to try and figure out what that deductible is going to take away from that treatment plan. It's all going to be in the system thinking on the back end for you.
Hmm. So awesome. Like that.
With that as well, kind of going all the way back to the beginning as far as scheduling those treatments and the reporting, it kind of meshes everything together. We have modules of lists, queues, etc., to get these treatments scheduled. So, unscheduled treatment. This is just one example of a list where it will show everything in the system that is unscheduled. You can filter anytime too. I should mention, you see kind of like that top bar where it looks like you could click into it. All of these fields in CareStack are filterable as well. So if you want to see everything from the Egan location, if you want to see everything for a certain provider or a proposed date, all of that's going to be filterable. And then you're going to be able to contact these patients directly. Let's get you scheduled. It's been a month. We know the insurance is accurate. What about today at 2 o'clock? This is going to help get that expedited and have a centralized database. And no longer are you going to have post-its of, hey, they want to come in this day. This is going to be all centralized in one spot.
Yeah. Very cool.
Opportunity minor too. This is kind of like the unscheduled treatment, but this really filters it down
Mm.
for you. So I created this one that I'm showing you where it's unscheduled crowns. So this is going to be every patient in the database that has an unscheduled crown that is in proposed, accepted, or I
Mm.
can't remember which other status I put in here, but it's pulling every patient in that database. It's going to give you their number, and you're going to be able to call these patients directly from this list. And I put a filter on there where you can see benefits remaining. So if this person has a crown and they have $3,000 of benefits remaining, they're probably going to be higher on my priority list than, say, somebody that has $50 remaining.
Yeah.
This is
This
also going
is
to go ahead.
another perfect huddle topic.
Exactly. And this was prime too about getting the schedule, that perfect scheduling, because okay, you have a crown that cancels. You want to keep your daily goals up and your numbers. Let's pull data quickly and effectively to get that high production into the schedule. Yes,
Mm.
of course, we need new patients as well, or like consults. But at the end of the day, if we're trying to meet numbers and we have all of this at our fingertips, why not get a crown in there instead? Keep those numbers up, keep that income coming in.
Yes. Hmm.
On this top, I'm not sure if you can see it again. I apologize if it's small, but I'd love to show you in a demo. But here you're going to be able to also mass email and text with these patients as well. You can see that there's 179 patients in this report that have a crown. The likelihood that that crown slot today is going to be filled is a lot higher when you're specifically reaching out to those types of patients and you've got 179 to choose from.
Yeah.
Let's get in touch with them all via text. We can help automate those texts as well, have a template, and boom, there it goes. You automatically sent 179 or 131 people that were opted in for texting a message, hey, let's get you in today.
Yeah. That's critical. Utilizing text. That's great.
Absolutely. Our odonogram as well is very customizable. At the end of the day, this is where the clinicians are working. So you are going to, again, have information at your fingertips. By hovering over the teeth, you're going to have a running history of what's existing, completed in office, planned, clinical images. You're also going to be able to filter information. If you say clicked on, say, number 14, you're going to see any notes associated with 14. And with our note system, this will transition into my next slide, but your notes are going to be automated as much or as little as you want. We help you with all of that set it when you're going through this process, but the notes can get down to the level of, hey, let's read them like a book on this bottom part of this screen. Let's have them automatically generate when a code is completed or planned. Let's have customized care panels for each individual user. And so each user would be assigned their specific care panel to help them streamline their treatment planning process, their charting process of existing work with new patients. All of that is within this module here and can be customized.
So cool.
You can even draw. I put a little star above number 9 just for fun.
Yep.
With our notes, there's so many options. So with the kind of pre-filled out text, that you're going to be able to click into that center column and directly add text. But we're also going to be able to help you automate, whether it be a single selection, a text box, a multiple selection, and also autofill. So what I mean by that is, say you always use lidocaine. If you're doing a prep, we can have it automatically selected that in this note template that, okay, I'm using lidocaine. But if you end up using another anesthetic, you're still going to have that generated in the system and can still select that and add that to your note if needed. The other really cool part of this is that we can help you where, say, you used a certain type of suture or did a specific type of incision or something. It could go up to, okay, you did this type of incision. The next 20 answers or kind of custom responses automatically get filled out based off of what type of incision you did. Was
Mhm.
it a punch? Was it like, what did you do? And everything else gets filled out. And again, you're going to be able to customize that, but that is then automated for you.
Makes
At any
sense.
point in time, too, you can save these as a draft. And so assistants can help. You're going to be able to help get that information in so that you're not trying to remember at the end of the day, okay, what did I use? This is all going to be able to be updated in real time and organized.
Yeah, it's great.
As you can see too, I added some color in there as well. Not needed, but you can do it. And this is where you would also assign these notes to a specific tooth. So then that way, again, boom, at your fingertips, you could see, okay, this was associated with whatever tooth is applicable.
Mhm.
Now to the module. So again, going back to that end of day example, you're trying to get through your day. You need to finish things up. Hopefully, you're not exhausted, but if you are and you need a centralized area to find all of your notes, you are going to have a clinical notes module. This will save so much time. I cut my time down at the end of the day dramatically. I would say at least by 50% because I was able to no longer have to go to each individual appointment and go into that clinical module, figure out what I needed to add. This is automatically going to filter out your notes if you're a provider. If you're not a provider, you can filter out to see specific providers and you can still help edit them, say like the front desk assistant, office manager. But if you are a provider, it's going to default to your notes. So you can go right down the list one by one, get all of that information submitted into that note and finalize. If you can't finalize it, if you need a reference number or something, you can always save as a draft and they will be right here waiting for you whenever you come back for them.
Yeah, very cool.
Anything questions wise that you can think of, Spencer, before I move
No,
on?
so clear and nice work. It looks awesome.
It's a really slick system. And I feel like I said that once before today, but again, having been in the shoes of, okay, I've got 500 things to do tonight. I can't be spending 40 minutes doing notes. This
Yeah.
is a huge benefit. Something so little can be so profound. And that's all I have for like this little tiny glimpse, but
It
there's
is.
so
It
much
is.
more.
It's a fast glimpse, but it's perfect, Jamie, and to just allow everyone to learn from hearing this introduction to it. And so, as you can see, this is um, posted here on our Facebook page. It's also posted here at dentistadvisors.com. So you can get to know Jamie and the CareStack team and the product. For those that are already using CareStack, Jamie is a great reference for utilizing some different options and putting together your huddle. And if you are looking at making some transitions, then Jamie is your point of contact. So feel free to reach out to Jamie at CareStack and feel free to reach out to me. And we are happy to help get things moving. But Jamie, thank you so much and great
Thank
presentation.
you. Thank you so much, Spencer. I really do appreciate it. And I hope to hear from you soon. Like you said, if you're an existing customer or new, I am here for you. I have access to people that can help if I can't. So please don't be a stranger. Anytime I'm here.
Thanks, Jamie.
Thank you.